This video describes the CHEETAH intervention. So how does the intervention work? Your theatre teams, including surgeons and scrub nurses, need to be trained so that at the start of all abdominal operations with an incision greater or equal to 5 centimetres that are predicted to be clean contaminated, or dirty, that extra sets of gloves should be available, and that at the start the scrub team should set aside clean instruments that include a needle holder, forceps and suture scissors. Gloves and instruments should be changed before closure of the abdominal fascia, which is typically done at the final swab counts and instrument counts. Who should change their gloves? All staff who will be scrubbed at the time of wound closure should change their gloves. This typically includes the surgeon, the assistant and the scrub nurse. If you double glove, change your outer glove only, and you should use your normal glove type and size from your hospital supply. These will be reimbursed as part of the CHEETAH trial. So when to change instruments? At the start of the procedure, the scrub team should set aside from the main tray a clean set of instruments. This includes needle holder, forceps and suture scissors. Additional sets of these instruments will be provided as needed on a site-by-site basis. These clean instruments should only be used at the end of the procedure when you are starting to close the abdominal fascia. This short video shows how to set aside clean instruments, but is just one example of how you might choose to do it, and you should adapt to your local needs. This video shows how to set up a set of clean sterile instruments. The scrub nurse selects out a needle holder, suture scissors and a pair of forceps and places them somewhere safe. In this case, she is wrapping them in a clean, medium-sized swab and placing that in a kidney dish. The scrub nurse is then storing these closure instruments somewhere safe where they can't get mixed in with the other equipment. The next video introduces and describes the patient pathway for CHEETAH.